The business community welcomes government's decision of reversing COVID-19 emergency regulations. UK charity Penny a Pin regrets child sexual abuse incident in the Gambia. And Africa CDC and AU to launch an African Against COVID-19 initiative to enhance efforts in the fight against the pandemic. This and more coming on The World Today. Hello, this is Africa TV and you are watching The World Today News Bulletin. I am Amadou Kante. Many thanks for joining us, and now the news in detail. Now, non-essential business owners have expressed delight at the news that they can now reopen for business after a week of total closure, which exposed them to severe economic problems. Africa TV went out and about to speak to its business owners on the latest development, and Omar Ahmed Toure has more in this report.
The revision of the emergency regulations effective Thursday will allow businesses dealing in food products to open between 6 a.m. and 2 p.m. daily. Those trading in non-food products shall open between 3 p.m. and 7 p.m. daily, while all non-food retail outlets located outside of markets shall open between 6 a.m. and 3 p.m. According to business owners, the 21-day state of emergency has exposed them to many financial hurdles, and most of them, daily wage earners, face difficulties meeting home bills, including food, water, and electricity. Ibu Cham, a teacher and a businessman, said he was once confronted by the police for opening his shop over allegations he violated emergency regulations. He breathed a sigh of relief as the government revises economically crippling emergency regulations that shut down their businesses and closed down markets just past midday.
Obviously, I can say it's a life saving towards my business, because obviously I uploaded these materials on Saturday. That very Saturday, after uploading, immediately I'm done uploading, I was surrounded by police and asked to close my shop. I think we all know what that means, because after paying a lot of money in the ports and then do certain things, shipping certain materials to the Gambia, and then you ask to close your shop, obviously it's very, very hard. So I can say it's a life saving, because it has saved my life, because I will be able to sell my product now, though I am not given fully Monday to open as I expected, but obviously I am relieved that there's a particular time that I can open my shop and then be able to sell my goods. So it's a life change, it is a life saving.
Abdullah Toure, who is also a shop owner in Sinchu Alaji, expresses gratitude for the reopening of non-essential shops. He said life has been difficult. Life has been very difficult within the last week.
For us to be truthful to God, it was very hard on us. These past days, a family man like me who struggles to get his money, and you ask that man to close his shop is really hard. There was a declaration and we abide by it until this happens today. That is the reopening.
After 5 days of completely shutting down non-essential businesses by emergency regulations imposed at the start of August, Babkar Ndao, a barbing salon owner in Sinchu Alaji, said the restrictions could have been catastrophic for many like him who live from hand to mouth.
If they close the place where we earn our living, people are going to suffer, and that has already begun. Another disease is spilling on another one. Corona is real, but the disease of hunger is more devastating.
Economic activities in the Gambia have been brought to a near halt with the restrictive measures that shut down non-essential businesses and closed down markets at 2 p.m. daily. The new state of emergency is necessitated by a surge in the number of coronavirus cases, which are currently at 1,556, with 43 deaths and 267 recoveries since the first case in March. For iAfrica TV, Omar Ahmad Toure.
And from the report there, next we head to the Democratic Republic of Congo, because their Congo's government has eased COVID-19 regulations as the country witnessed recent reduction of the coronavirus cases. Over the past 4 months, the COVID-19 cases have rapidly increased in Africa, and a team of WHO health professionals is supporting the government efforts in the fight against the disease in the capital. Authorities have urged the public to observe COVID-19 health regulations despite the recent drop in cases. Here's more details of that.
COVID-19 cases have increased in African countries over the past 4 months. According to the WHO, confirmed cases have more than doubled in July amid a shortage of testing kits and poor access to data. A team of WHO health officials is supporting the DRC government tackle COVID-19 in the capital.
The COVID-19 started when we were still fighting against Ebola in the east of the country. We transferred some of our experts from North Kivu to Kinshasa to help us to fight against COVID-19.
The global health body says it has also increased its support to African countries which requested assistance in dealing with the pandemic.
We are continuing to work with local authorities to expand public health capacities, including more than 30 countries that have decentralized lab or laboratory testing capacities. As I said, countries are opening up borders, and there are challenges in detecting and managing imported cases and sustaining the intensity of these public health measures as economic activities resume.
Congolese authorities lifted some of the COVID-19 restrictions across the country last month. Airports and places of worship are expected to reopen on August 15th.
The DRC government has underscored the need for the public to continue adhering to the COVID-19 measures despite the recent reduction in monthly cases. It has ordered the police to fine or arrest people who are not wearing masks in public.
The DRC government there is in COVID-19 regulations as the number of COVID-19 cases drops in the country. And from that report, we come back home because the Gambia government on Wednesday announced the closure of the Penny Appeal orphanage in Yarambamba due to the allegations of child rights abuses. A committee comprising of the police, a child welfare unit, Department of Social Welfare, and the child rights unit of the Ministry of Justice and the Child Protection Alliance has been set up to investigate the allegations. Let's have more details of that in this report.
Penny Appeal, the Gambia has said it regrets reports of child sexual abuse and exploitations that occurred in July this year at Anansurun, an orphanage it provided with funding and children to take care of. The UK-based charity Penny Appeal operates in more than 30 countries worldwide and was founded by Adin Yunus, an English-Pakistani philanthropist. The Penny Appeal orphanage in Yarambamba, West Coast region of the Gambia, had its operations shut down by the Gambia government after initial investigations found children were being subjected to sexual abuse and exploitation in an orphanage it has ties to. While Penny Appeal UK did not respond to Africa TV email inquiries, the acting director of Penny Appeal, the Gambia, Boba Saidi Khan, told iAfrica TV editor Modu Diouf via phone that the incident is regrettable.
Where we have given the 285 children, 285 children to an organization called NonEssential. Okay, for taking care of the children, and we have funding of children from January to August. From January to August to date, Penny Appeal have only one center, accommodating only 100 children. So The said incident does not happen to centers at Penny Appeal Center at Yarambamba.
Okay.
It happened at where Anasu, a local charity, is where they are taking care of children. And Nasu is at Kotu.
So what did you make of the allegations that resulted in the closure of Penny Appeal?
We regret everything that happened. That was not our intention, and our intention is to take care of the children, poor and needy people, and a lot of things, but this was not our intention. We regret what happened anyway.
The reports of abuse and sexual exploitation of children at Penny Appeal supported orphanages are said to have occurred within the Greater Banjul area and the West Coast region in July 2020. The Gambia's Ministry of Women, Children and Social Welfare said in a statement Wednesday that it has temporarily closed the orphanages with immediate effect pending the outcome of investigations into allegations of child exploitation, sexual abuse and other child protection matters. Lamin Fati, National Coordinator of the Child Protection Alliance, said initial investigations found accommodation of children under the Penny Appeal-funded Anasarum orphanage were bad and the funding inadequate.
Penny Appeal had entered in an agreement, kind of like a contractual agreement with another institution called Anasuru, where Penny Appeal actually has been receiving about £186 on behalf of every child per quarter, but they only giving £50 to Anasuru. I don't know how they define exploitation, but it's easy that if you are using children to kind of like gather or to generate funding, and the funds are not fully utilized to the welfare of those children, it tantamounts to exploitation. And we have seen over evidence that, well, even as to the facilities that these children has been exposed to, is not the best of facilities that anyone will have for a child care institution in the country. We have seen videos where children, they lie on bare floor, tiles, and they don't even have a proper accommodation in place.
Fati's Child Protection Alliance is part of a government-instituted task force investigating the matter. He said the two institutions, Penny Appeal and Anasarum orphanages, as institutions have a duty to protect children under their care as provided under the Child Rights Law of the Gambia.
Now the issues of abuse, particularly the issue of sexual abuse, the law is very clear. It's even as where you have your facility given out to someone who uses that facility to sexually abuse a child, the state has made it categorically clear you are found liable for such crimes happening within your premises. Talk less of you have a whole organization that has created facilities having children living in those facilities yet been subjected to sexual abuse cases. So which means that is cross violation of the fundamental right of those children, even as where, because the report that we have received is that these sexual abuses happen among children themselves. And if I said among children themselves, it's not about a boy and a girl, no. Because this, we only visited the facility, and the footages that we have is only one facility, which is somewhere in Kirsering. That boys within that facility actually abuse younger boys sexually. So we have about 3 or 4 evidence that has been given out where children actually attest to the fact that they were sexually abused by the older boys within the facility.
In 2018, Penny Appeal's founder Adim Yunus, an international boxing champion American, inaugurated a new orphanage village complex, saying it was a state-of-the-art in West Coast region. The orphanage was operating illegally, according to Gambia's Ministry of Women's and Children Affairs, and that its operations have not been sanctioned by the Department of Social Welfare, which is responsible for granting permits to child care centers and orphanages.
And from the report there, next we report on matters of the COVID-19, because as the fight against the pandemic continues, the Africa Center for Disease Control and the African Union Commission have launched, of course will be launching rather next week, an African against COVID-19 initiative during the high-level African Union Bureau meeting of head of states and governments. The initiative is necessitated by the need to save lives, economics and livelihoods. The Africa CDC said a consortium for COVID-19 trial has been submitted to the AU for approval. Let's have more details of that in this report by Sona Tunkara.
The Consortium for COVID-19 Vaccine Trials, which was established to ensure Africa's leadership in the development and access of COVID-19 vaccine, has developed a vaccine strategy for the continent, which has been submitted to AU leadership for approval. During the epidemiological situation weekly press briefing on coronavirus on Thursday, Dr. John, Director of Africa CDC, says sites have been identified to enhance the process of vaccine clinical trials.
Sites have been identified and categorized into 3 tiers. The first tier being clinical trial sites that can readily start vaccine trials. The tier 2 sites are those that will require some minimum capacity building and development to get us to where it has to be. And then the third tier are those that require some substantial amount of investment. A steering committee has been put in place, and we had a meeting, a broad consultation meeting yesterday with across the continent and outside, and stakeholders from outside the continent. We are hoping that in the next coming weeks, we'll be able to develop a comprehensive guidance for countries to use to develop vaccine plans. That is, in case there's an effective vaccine today, what do we do as a country to roll out those vaccines at the country level?
With healthcare workers facing devastating attacks by the virus, 50 countries in Africa have reported 35 deaths of healthcare workers infected with COVID-19. The source of transmission among healthcare personnel and the community, according to John, is uncertain, and as a result, the Africa CDC will embark on a capacity training across its member states on infection control and prevention for healthcare workers.
Our healthcare workers have the right infection prevention and control measures. So because of that, we are cascading training across multiple countries as Africa CDC to enforce and provide the capacity for infection prevention and control, what we call IPC measures, because that is key. We are dealing with a virus that is very easy to be transmitted. It spreads very quickly, and if we do not ensure the appropriate IPC measures, infection prevention control measures, you see that a large number of our healthcare workers will be infected, and the consequences will be devastating for our healthcare system as a whole on the continent.
Dr. John, in today's briefing, emphasized on the importance of the African continent taking the lead to fight against the virus with the adoption of traditional medicine.
It would be a mistake that we do not factor in our traditional remedies into the fight against COVID and other diseases. I think we are very encouraging of those that participation. We're also saying that when we do that, let's do it in a way that is standardized. Let's do it in a manner that it shows efficiency. Let's do it in a manner that there's efficacy, which means any product that we put out there shows that it is effective and also safe for the patient. And we are very open to that. I mean, we should evolve to a manner that our traditional medicine is also recognized as what it.
The global number of COVID-19 cases is over 20 million. In Africa alone, more than 1 million cases have been confirmed, with a death toll of over 24,000. However, there has been a significant improvement in the number of recoveries, as over 769,000 people are reported to have recovered from COVID-19. For iAfrica TV, Sohna Tunkara.
The Africa CDC and AU launches an African initiative to battle against the pandemic. And from that report there by Sona Tunkara, we will now take a break and come back shortly with the remaining of the stories. Stay with us, we'll be right back. Welcome back, and you are watching the World Today News Bulletin on Africa TV. And now to the rest of the stories. And of course, we head to matters of the COVID-19 because as the government made amendments on the coronavirus regulations to cope its effects in the Gambia, the number of coronavirus deaths and cases continues to rise in the country, with a total number of 1,556 reported since the outbreak in March. Here's more details of that by Ndesise.
As the Gambia registered 20 new recoveries from the coronavirus on Thursday, bringing the total recoveries to 267, the country also recorded 10 new deaths from COVID-19, the highest in a single day, making a total of 43 deaths since March. With a drop in the number of new cases compared to the last 2 days, the Gambia recorded 79 new cases on Thursday. The country has now 1,556 confirmed new cases, out of which 1,246 are active cases. The 117 National Situation Report published by the Ministry of Health indicated that more than 70% of the new cases are residents of Western Health Region 1. The report further stated that 7 of these new deaths are males and 9 are aged 45 years and above. As indicated in the report, 184 new laboratory test results were received from Medical Research Council of the Gambia and National Public Health Laboratory. And of this, 7 new tests returned inconclusive and 79 new tests were positive for COVID-19. While 23 people were newly taken into quarantine, 10 new discharges were made. The country currently has 354 people in quarantine, 172 probable cases and a crude case fatality ratio of 2.8%. COVID-19 continues to cross borders in the Gambia since the country registered its first case in early March. Since then, the Gambian government has announced several measures aiming at preventing the spread of COVID-19 in the country. These measures include the mandatory wearing of face masks in public places, prohibition of public and social gatherings, nightly curfew between the hours of 10 p.m. and 5 a.m., and fumigation of markets on Sunday. For iAfrica News, and DCC.
And that is the latest update of the COVID-19 situation there, reported by DCC. And from that, next we head to UK, because the UK government intercepted migrant crossings into its territory from France. The migrants intercepted while trying to cross the channel were brought to Dover Airport to border force vessels on Wednesday, as crossing have surged in recent days. The UK Prime Minister Boris Johnson, however, described the action of the migrants as very bad, stupid and dangerous thing to do. Details of that in this report by Fatoumatou Fati.
Migrants intercepted while trying to cross the river channel between UK and France. They were brought to Dover aboard a border force vessel on Wednesday, as the number of people crossing has risen in recent days. UK's Prime Minister Boris Johnson condemned the crossing of migrants and described smugglers as cruel and criminal gangs that were risking the lives of the vulnerable. He said that the act is very stupid, bad, dangerous, and criminal thing to do. Prime Minister Johnson says his government will want to work with French authorities to curb the problem at hand. He added that possible legal changes were being considered, as once migrants enter the country, it becomes very difficult to send them back, even after knowing they came through the wrong way. There has been an increase in the number of migrants attempting to cross the channel this year in small boats, with more than 4,000 reportedly making the crossing since the start of 2020. UK Home Office figures indicate a record of 235 migrants intercepted last Thursday, in a week where over 700 people were intercepted. France and UK are separated by a channel called English Channel, also called the Channel La France Marche, on the narrow arms of the Atlantic, separating the southern coast of England from the northern coast of France, and tapering eastward to its junction with the North Sea at the Strait of Dover. Since then, people have been using the route as a means of migrating to either the UK or France.
And from the report there by Fatoumata Fati, we end this news bulletin with matters of the COVID-19 again, because the African Union has commended China for the continued support in the fight against the COVID-19 global pandemic. As Ethiopia received 2 medical consignments from China, the latest donation or donated medical equipment is expected to boost the global efforts in the fight against the pandemic. As the number of the coronavirus cases continues to spread across the continent, AU is calling for more support for Africa. Here's more details of that in this report.
Ethiopian Minister of Health Elia Tadesse has received 2 consecutive deliveries of medical supplies from China this week. First from the First Lady of China, and second from ByteDance, a China-based tech company and owner of the app TikTok. African Union officials say the efforts are commendable and a sign of uninterrupted solidarity with Africa, and the world must unite as one to battle COVID-19.
Africa already decided in fighting COVID-19 as one, but we need the rest of the world to support Africa, especially in strengthening our health systems, in strengthening our capacity to fight COVID-19, and also in supporting us by medical supplies.
Many African nations are procuring medical and testing supplies through the African Union's COVID-19 fund.
Every medical supply that's not produced in Africa, we would like to make sure that we can get it from outside Africa, either donated or through the mechanisms we established, like the anti-COVID-19 fund and the medical supplies platform that we established to facilitate the pool procurement of the medical supplies for African member states.
The African Union is also calling for more economic cooperation across the continent.
Not only a health issue, it is a socio-economic impact that's caused by this COVID-19. That's not why we need the solidarity to be a global solidarity. We need all of us to fight, to come together, all of us globally to fight COVID-19, and for all of us to make sure that even after COVID-19, we will continue in this togetherness and this solidarity to make sure that we will bring the economies to our normal base. We will be fighting other consequences of COVID-19.
For Africa's CDC officials, the swift and ample provision of COVID-19 vaccination is another soon-to-be tackled issue. Now that the hope of a working vaccination is becoming a reality by the day, Africa wants to make sure it is not left behind from access to timely vaccination supplies.
China there continues its support for Africa in the fight against the COVID-19 pandemic. Well, viewers, that's all we have for you, and of course this eventually also brings us to the end of this news bulletin. But for more details on these stories and others, you can also log on our website on iafrica.tv. Once again, many thanks for the pleasure of your company. Stay safe, thanks for watching, and bye for now.
Debunking COVID-19 Myths. Myth